Your body's cellular repair processes also depend on uninterrupted sleep cycles. Growth hormone release peaks during deep sleep stages, and this hormone is essential for maintaining muscle mass, bone density, and skin integrity as you age. When sleep gets fragmented repeatedly, your body produces less growth hormone, which accelerates the aging process and makes you more fragile overall. The sleep deprivation creates measurable changes in your decision-making ability and reaction times. Your brain's prefrontal cortex, which controls executive function and judgment, cannot function properly without adequate rest. This impairment increases your risk of accidents during daily activities and makes it harder to manage medications correctly or make important health decisions. What makes this situation particularly dangerous is how it creates a downward spiral affecting multiple body systems simultaneously. Poor sleep increases inflammation throughout your body. Chronic inflammation damages blood vessels, contributes to arthritis and joint pain, and interferes with your body's ability to regulate blood sugar levels. Many seniors develop diabetes complications that seem unrelated to their sleep problems, but actually stem from chronic sleep disruption. Your balance and coordination deteriorate when you don't get sufficient deep sleep. The part of your brain that controls balance needs uninterrupted rest to function properly. Sleep-deprived seniors show measurable decreases in stability and reaction time, which directly increases their fall risk even during daytime activities. This creates additional safety concerns beyond just nighttime bathroom trips. The psychological effects compound these physical problems, creating a cycle that becomes increasingly difficult to break. Chronic sleep deprivation alters brain chemistry in ways that promote anxiety and depression. Many seniors develop anticipatory anxiety about bedtime, knowing they'll wake up repeatedly. This anxiety makes it even harder to fall asleep initially and creates additional stress hormones that interfere with natural sleep processes. Your metabolism also suffers significantly from interrupted sleep patterns. Sleep disruption affects hormones that control hunger and satiety, leading to weight gain and difficulty maintaining healthy eating patterns. Excess weight puts additional pressure on your bladder and can worsen nocturia symptoms, creating another layer of the downward spiral. The sympathetic nervous system becomes overactive when sleep gets repeatedly interrupted. This system controls your fight or flight response, and when it stays activated too frequently, it contributes to high blood pressure, irregular heart rhythms, and digestive problems. Your body essentially remains in a state of mild stress even during daytime hours when you should be relaxed and restored. But here's the encouraging news that should give you genuine hope about solving this problem. The vast majority of nocturia cases in seniors aren't caused by serious underlying medical conditions that require complex treatments or medications. Research consistently shows that specific correctable behaviors are usually the primary culprit behind these sleep disruptions. Your body has remarkable natural mechanisms for concentrating urine during nighttime hours and reducing the need for bathroom trips. These mechanisms work beautifully when they're not being interfered with by particular evening habits that most people consider completely harmless or even beneficial. The problem isn't your age or your overall health status. The problem is that certain behaviors are disrupting your body's natural preparation for sleep. Understanding this distinction is crucial because it means you have much more control over the situation than you might have believed. When you identify and modify the specific habits that interfere with your body's natural sleep preparation, you can often see dramatic improvements within just a few days or weeks. There's one particular evening habit that stands out above all others as the most common culprit behind these nighttime disruptions. And what makes it so dangerous is that most seniors actually believe this habit is helping their health rather than harming their sleep. The evening ritual that's sabotaging your bladder. The specific evening habit involves fluid timing, and research shows that avoiding fluids 3 hours before bed allows for the natural vasopressin surge that your body needs for uninterrupted sleep. This timing element directly interferes with your body's natural hormone production during evening hours. Your body produces a crucial hormone called vasopressin, which acts like a natural alarm clock for your kidneys. Vasopressin signals your kidneys to concentrate urine and reduce production during nighttime hours so you can sleep without interruption. This hormone typically begins increasing in the early evening as your body prepares for sleep. The problem occurs when evening fluid intake disrupts this delicate hormonal process. When vasopressin production gets interfered with, your kidneys continue producing urine at daytime levels throughout the night. Instead of your body naturally concentrating urine and reducing output, your kidneys keep working as if it's still mid-afternoon. This creates a cascade effect where your bladder fills repeatedly during sleep hours, forcing you to wake up multiple times. The physiological mechanism behind this disruption involves your body's circadian rhythm and how it coordinates with kidney function. Vasopressin release follows a specific pattern that peaks during nighttime hours when you should be sleeping deeply. When evening habits interfere with this natural cycle, your kidneys lose the signal to shift into their nighttime conservation mode. The result is continued high-volume urine production when your body should be in rest and repair mode. Let me share the story of Margaret, a 72-year-old from Phoenix who struggled with this exact problem for nearly 3 years. Margaret would wake up 4 to 5 times every night to use the bathroom, leaving her exhausted and frustrated the next day. She tried reducing her water intake after dinner, avoiding caffeine completely, and even consulted multiple doctors who couldn't find any underlying medical problems. Margaret was doing something every evening that she believed was supporting her health and helping her sleep better. She would have a large cup of chamomile tea around 8:30 in the evening while reading or watching television. She also enjoyed a bowl of vegetable soup before bed, thinking the warm liquid would help her relax and fall asleep more easily. Both of these habits seemed completely innocent and even beneficial for someone trying to maintain good health. What Margaret didn't realize is that consuming any liquid within 3 hours of bedtime directly interferes with vasopressin production and keeps her kidneys in active daytime mode throughout the night. The timing of her liquid intake was sabotaging her body's natural preparation for sleep, even though the liquids themselves weren't harmful. Her chamomile tea and evening soup were essentially telling her kidneys to stay alert and keep producing urine when they should have been shifting into conservation mode. Once Margaret understood this connection, she modified her evening routine by moving her tea time to before 6 in the evening and having her soup with dinner rather than as a bedtime snack. Within 2 weeks, she reduced her bathroom trips from 5 times per night to just once. After a month, she was sleeping through the night completely most nights and waking up feeling refreshed and energetic for the first time in years. The specific timing element is crucial because your body begins preparing for sleep approximately 3 hours before you actually go to bed. During this preparation period, vasopressin levels start increasing and your kidneys begin shifting into their nighttime conservation mode. Any liquid intake during this critical window disrupts the hormonal signals and keeps your kidneys operating in daytime production mode. This evening activity involves more than just obvious liquids like water, tea, or juice. Many foods contain hidden liquid content that contributes to the same problem. Fresh fruits with high water content like watermelon, grapes, or oranges consumed in the evening can trigger increased urine production. Soups, broths, and even ice cream provide liquid intake that interferes with your body's natural sleep preparation. The type of evening liquid consumption matters significantly beyond just the timing. Certain beverages contain compounds that act as natural diuretics, stimulating even more urine production than plain water would cause. Herbal teas that many seniors drink for relaxation often contain ingredients that increase kidney activity. Coffee and regular tea obviously contain caffeine, which is a known diuretic, but even decaffeinated versions can stimulate urine production through other compounds. What makes this situation particularly frustrating is that conventional wisdom about evening routines gets this completely backwards. Most health advice encourages staying hydrated throughout the day and evening. Many articles recommend herbal tea before bed for better sleep. Doctors often suggest warm liquids to help with relaxation and digestion. None of this advice considers the impact on vasopressin production and nighttime kidney function. The modification needed to reverse this problem involves establishing a liquid cutoff time approximately 3 hours before your intended bedtime. This means if you typically go to bed at 10 o'clock, you should avoid consuming any liquids after 7 in the evening. This includes water, tea, coffee, juice, soup, and foods with high liquid content like fresh fruits or ice cream. For seniors who take medications that require water, you can prepare a small amount beside your bed for emergencies or essential medications only. The key is limiting liquid intake to the absolute minimum during those crucial 3 hours when your body needs to prepare for sleep. This modification allows vasopressin production to increase naturally and signals your kidneys to shift into their nighttime conservation mode. The timing adjustment addresses the root cause rather than just managing symptoms. Instead of restricting liquids all day, which can lead to dehydration, you're strategically timing your fluid intake to work with your body's natural rhythms. This approach allows you to stay properly hydrated during daytime hours while supporting optimal sleep quality during nighttime hours. This revelation about liquid timing represents a fundamental shift in understanding how evening routines affect sleep quality in seniors. The modification is simple to implement, but requires understanding the physiological mechanisms at work. Once you align your liquid intake with your body's natural hormone production cycles, you can restore the sleep patterns you enjoyed when you were younger. However, fluid timing is just one piece of the puzzle. And there's another factor that most people never consider that can have an equally powerful impact on your nighttime bathroom trips. The circulation secret that changes everything. Your circulation patterns play a crucial role in determining how often you wake up during the night. During your waking hours, gravity causes fluid to accumulate in your legs and lower body, especially if you spend significant time sitting or standing. This fluid accumulation happens gradually, and most seniors don't even notice it occurring until evening when they finally lie down to sleep. The connection between daytime fluid buildup and nighttime bathroom trips involves a process called venous return. Throughout the day, your leg muscles act like pumps, helping push fluid back up toward your heart and kidneys. When these muscle pumps become less efficient due to prolonged sitting, reduced activity, or age-related changes, fluid starts pooling in your lower extremities, creating what doctors call lower extremity edema. The problem intensifies during evening hours when many seniors engage in activities that accelerate fluid redistribution at exactly the wrong time. When you elevate your legs while watching television or lie down to read in bed, you're essentially triggering a massive fluid shift back into your bloodstream. Your kidneys suddenly receive this surge of fluid that's been accumulating in your legs all day, and they respond by producing large amounts of urine to process this unexpected volume. This physiological process involves your vascular system and how it interacts with kidney function during evening hours. When a person with significant lower extremity edema lies down, much of the extra fluid is returned to the vascular system, where the kidneys can excrete it, increasing urine production shortly after the patient assumes a recumbent or supine position. Your kidneys interpret this fluid surge as excess volume that needs immediate elimination, rather than recognizing it as redistributed fluid from your legs. The venous return process becomes particularly problematic for seniors because aging affects the efficiency of your circulatory system. Your leg muscles may not pump fluid as effectively as they once did, and your blood vessels lose some of their elasticity, making it harder to move fluid upward against gravity. Additionally, many seniors have underlying circulation issues that compound this problem even when they don't realize these issues exist. Recent research demonstrates the remarkable impact that understanding circulation patterns can have on nighttime urination frequency. According to StatPearl's research, sleeping on the left side with a pillow between your legs can reduce nocturia by up to 40% with just this simple change. The positioning strategies that optimize nighttime circulation can provide relief much faster than most people expect, often showing improvements within just a few nights of implementation. Let me tell you about Frank, a 71-year-old ex-military man from Denver, Colorado, who discovered firsthand how powerful circulation awareness can be. Frank had been waking up 3 to 4 times every night for over 2 years and was becoming increasingly frustrated with his disrupted sleep. He had tried limiting fluids, reducing caffeine, and even consulted his doctor about potential prostate issues, but nothing seemed to help his situation. Frank always slept on his stomach, a position he'd maintained since his military days decades earlier. He never connected his sleep position to his bathroom trips because the connection seemed completely unrelated to his nighttime urination problems. What Frank didn't understand is that sleeping on his stomach was creating pressure on his bladder, while also interfering with optimal venous return from his legs. The biomechanical science behind sleep positioning reveals why Frank's stomach sleeping was contributing to his nocturia. Sleeping on your left side with a pillow between your legs and keeping your spine aligned allows the bladder to assume its natural position without external pressure. Furthermore, this position improves venous return, reducing fluid buildup that needs to be eliminated during the night. Frank transitioned to sleeping on his left side with a pillow between his legs after learning about the circulation connection to his nighttime bathroom trips. The change felt awkward initially since he'd been sleeping on his stomach for most of his adult life, but he was determined to find relief from his sleep disruptions. Within 2 weeks, he reduced his nighttime bathroom trips from 3 times to just once, and after a month some nights he slept completely uninterrupted. The timeline for seeing improvements once circulation factors are addressed varies among individuals, but most people notice changes within the first week of implementing proper positioning strategies. Your body adapts quickly to improved circulation patterns, and your kidneys begin responding more appropriately to fluid redistributions when pressure on your bladder decreases and venous return improves. Understanding circulation patterns provides multiple benefits beyond just reducing nighttime urination frequency. Improved venous return during sleep helps reduce morning swelling in your legs and feet. Better circulation supports overall cardiovascular health and can help reduce the risk of blood clots that sometimes develop from poor circulation during nighttime hours. To mitigate the effects of fluid accumulation, it is recommended that patients elevate their lower extremities before bed. This strategy helps encourage fluid return to your bloodstream gradually rather than all at once when you lie down to sleep. The gradual redistribution gives your kidneys time to process the fluid without creating the sudden surge that triggers urgent bathroom trips. Compression stockings worn during the daytime, especially in the afternoon and evenings, can also help minimize tissue fluid sequestration in the lower extremities before bedtime. These stockings provide gentle pressure that assists your natural muscle pumps in moving fluid upward throughout the day, preventing excessive accumulation that creates problems when you lie down for sleep. The positioning strategies that optimize nighttime circulation involve sleeping on your left side, maintaining proper spinal alignment, and using pillows to support optimal circulation throughout the night. These adjustments work with your body's natural processes rather than fighting against them, and the results often exceed what people expect from such simple modifications to their sleep routine. While circulation and positioning represent powerful tools for reducing nighttime urination, there's another factor that operates on an even deeper level, affecting the very hormones that control your sleep patterns. This factor involves something millions of seniors do every evening, believing it will help them rest better when it's actually creating the opposite effect. Involves meal timing and how eating patterns affect your body's natural hormone production cycles. There's a specific evening eating habit that millions of seniors engage in, thinking it will help them sleep better, but it's actually triggering a hormonal cascade that keeps them waking up all night long. This habit seems so beneficial for relaxation and sleep preparation that most people would never suspect it could be sabotaging their rest. The activity directly interferes with your body's production of anti-diuretic hormone, which is absolutely essential for sleeping through the night without bathroom interruptions. Your body produces anti-diuretic hormone, also called vasopressin, through a complex process that begins several hours before bedtime. This hormone acts as a natural signal to your kidneys, telling them to concentrate urine and reduce production during nighttime hours. When vasopressin levels increase properly in the evening, your kidneys shift into conservation mode, allowing you to sleep for 7 or 8 hours without needing to urinate. The evening eating pattern that disrupts this process involves consuming large meals or significant amounts of food during the hours when your body should be preparing for sleep. Many seniors eat their largest meal of the day at dinner time, often between 6 and 8 in the evening. Others enjoy late evening snacks while watching television or reading. These eating patterns directly interfere with your body's natural hormone production cycles and disrupt the physiological processes that support uninterrupted sleep. The connection between meal timing and hormone production involves your digestive system and how it interacts with your endocrine system during evening hours.